Good afternoon, and now I will be discussing about death and dying. So after I discuss the uh, human lifespan from birth to adulthood, so we will be discussing the last stage of the human growth and development, which is the death and dying. So as nursing assistant, what are the things that we need to do and what is our role during death or during care of dying patient. So take a look. Let's take a look. So first, let us define what is grief. So grief, this is the usual emotion that we are feeling for those patient or those family members that is lost. So it is defined as mental anguish specifically associated with loss. So according to Kobler, he made a steps or he made a cycle of grieving process. So the acronym for that is DABDA. So DABDA means D for denial, A for anger, B for bargaining, D for depression, and A for acceptance. So, according to Kubler-Ross, without this cycle, the patient or you or any person will undergo this cycle. So it will start from denial and it will end to acceptance. So if your patient or if your relative is telling you, I accepted already the situation, your patient or that person is lying because he or she will need to undergo first the denial stage, then anger until to acceptance. So this will be the cycle. So under denial, so we will see a person who is under denial or the first stage, there is an avoidance of feeling. There is a confusion. Then there is an elation, shock, or fear. Under anger, it will be frustration, it will be irritation, anxiety. Bargaining is struggling to find meaning. Why it's happening to me? Why this is happening to me, not to others. So this is bargaining, reaching out to others, telling one story. Then depression is, of course, you're very down, overwhelm, helplessness, hostility, and flight. And lastly, if you already undergone this four stages, so you will accept the situation. So exploring options, new plan in place, and you will move on. So under this cycle, you need to first information and communication. Okay, the first and second stage, you need to have to gather information and to communicate well to your patient. Especially you use therapeutic communication. Then emotional support during bargaining and depression, and then guidance and direction during acceptance. So, what are the things we can do for dying person? First, what are those needs that we need to meet? Uh, Dying people have psychological, so you need to care them holistically. It means you need to care totally take care of them totally in their psychological needs, social needs, and spiritual needs. You need to listen and use touch, but not all patients, okay? You can use touch. It depends upon their culture. So you should have a cultural competency of each patient. So vision, hearing, and speech. Usually, vision blurs and gradually fails. Explain what you are doing to the person or in the room. Provide good eye care. Then, hearing is the one of the last functions lost. Okay, they considered hearing as the last uh, a sensory function that is lost. So always assume that the person can hear. So if you're planning to kill the person because you you feel that he is dead or he is unconscious, okay, you're wrong because maybe this person is hearing you. Then speech becomes difficult. Anticipate the person's need. Do not ask questions that need long answers. So you always explain briefly and accurately to the patient. Then, caring for mouth, nose, and skin, frequently do oral care because most of them they don't want to eat, okay, or they have less appetite, so they have dry skin, they have dry oral cavity, so you need to have a frequent oral hygiene. Then crusting and irritation of nostrils, maybe they have NGT or nasogastric tube, so always clean the nose. Usually you can use water, warm water, or you can use normal saline. Then skin care, bathing, and preventing pressure ulcers are necessary. Then change linens and gowns whenever needed. So as what we've discussed in hygiene, we need to do also for this patient because they need more support than the other patients because they are dying. Then elimination, usually they are incontinent, urinary and fecal incontinent. So we always give them perineal care. Then comfort and positioning, we need to do skin care, personal hygiene. We can do back massage, oral hygiene, good alignment, so to promote comfort. Then we need to position them and place a supportive device for comfort. And always place them into semi-Fowler's position if they have difficulty breathing. Then, person's room should be always fixed. The person's room should be always comfortable and pleasant. So it should be well lit and well ventilated. Remove unnecessary equipment. If your patient is using urinal or bedpan, immediately remove it from their site. So the place will be appealing and comfortable for them. Then, mementos, pictures, cards, flowers, and religious items provide comfort. Then person and family arrange the room as they wish. Then hospice care. Hospice care are designed to give supportive care to people in final phase of life. Those patient who is in terminal stage already, they cannot treat the diseases. So, for example, cancer, it's already terminal. There's no cure. There's no treatment. So hospice care is given. So hospice care focus on comfort and quality of life. So they are making sure that the patient is that they are decreasing the pain of the patient, that they are providing or promoting comfort for the patient to give a quality of life. Then a goal is to enable persons to be comfortable and free of pain. Then caring for the family, of course, family is the first line of support for this patient. We need to take care of them also, especially during those times who where they need emotional support. The family goes through stages like dying person. Okay, if the dying person is feeling pain, of course they are feeling pain more because especially if they are mother, if they are parents, and they are seeing their children who are in pain, of course, the pain is double for them. Then be available, courteous, and considerate. Always we are using therapeutic communication. It's very useful during this stage. Then the person and family need time together. However, you cannot neglect care because the family is present. So now we'll go to the stages of death. We have 3 stages of death. We always remember, so we will not have confusion. We always remember what is uh this is based from the alphabet order. So you will not exchange what is the first stage, the second stage, the third stage. So first is algor mortis. So it will start with A. So it will be the first. Algor mortis is the cooling of the body. Okay, after the person or the patient died, it will undergo a process of cooling or cooling of the body. So called it will be called as algor mortis. Then next is L. Livor mortis is the discoloration of the body after death due to the gravitational settling of the blood. You will notice if you place the patient in a supine position, the blood by the force of the gravity will go down, and almost all of the blood or discoloration or bluish discoloration you will see on the back because the blood is settling on the settling down. Then the last is rigor mortis. Rigor mortis is the stiffening of the body. Okay, so make sure if your patient died open mouth, okay, open mouth, open eyes, make sure before rigor mortis before happen before rigor mortis happen, you close already what need to be closed, like mouth and then the eyes, because it's very difficult to close them if rigor mortis already happened. So what are those things that we need to do during postmortem care? First is we need to remove equipment and soiled linens. Okay, if the person died, we need to remove what are the equipments attached to them, like cardiac monitor, vital signs equipments or vital signs machines, or IV tubings. We need to remove them, and soiled linens. Okay, because we need to change new ones so they, even if they are dead, they are comfortable. Then straighten the body and the limbs. As I've told you, if rigor mortis happen, okay, it's very difficult to straighten what needs to be straightened. So straighten those body and limbs that needs to be straightened. Next is remove the linens, tubes, and dressing as per policy. If your patient is having all the tubes in the world, like NGT, tracheostomy, urinary catheter, IV tubings, you need to remove all of them. Okay? Then replace the dentures. Usually in the hospital, they are removing the dentures. They are giving the dentures to the family members. They are putting in a bag and then they are giving to the family. Then close the eyes. You need to close the eyes. Place a pillow under the head so it will not be stiff after rigor mortis. Then follow a towel under the chin because the patient may flex and it's very difficult to extend again or straighten again. Then you need to wash the body. You need to do what you are doing in those normal patient, which is bed bath. You need to do bed bath the same way you are doing to normal person. Then place a pad under perineum. Why? Because all of the secretions, the poops, the urine, it will go out. All the secretions, nose, ears, it will go. That's why we are putting also cottons in the nose and in the ears. Then we need to change the linen and the gown. Okay, because we gave bath, of course, we need to change the linen and the gown. So these are the things we need to do during postmortem care. By the way, you cannot do postmortem care alone because it's very difficult to do it alone because this time the weight of the patient is more compared to normal person. So you need to have assistant. So in in covering the patient using the mattress or the linens, okay, this is the way. Okay, so you just fold in this way. You fold in the top and then on the side and then you tape it. So assisting with postmortem care, we need to practice hand hygiene. We need to collect the supplies needed like the bed bath equipments and the kit for removal of the IV cannula and everything. Then raise the bed for body mechanics. So for you to do it, okay, without body pain or back pain. Then make sure the bed is flat. Put on gloves. Then position the body into supine position. Arms and legs are straight. Pillow is under the head and shoulders or raise of the bed 15 or semi-foulers. Then close the eyes of the patient. Gently pull the eyelids over the eyes. Apply moist cotton balls gently over the eyelids if the eyes will not stay closed. Okay, especially if already long time the patient died, okay, it's very difficult to close the eyes. So you can put a moist cotton balls. Then insert dentures if it's agency policy to do so. If not, put them in a labeled denture cap and give them to the relative. Then close the mouth if necessary. Place a rolled towel under the chin to keep the mouth closed. Follow agency policy for jewelry. Any jewelry, remove all jewelry except for wedding rings if this is agency policy. But most of them, they are removing all the jewelry so to make to not be liable of any loss, and then they are giving it to the relative after placing to the envelope. Then place a cotton ball over the rings, tape them in place. Then remove drainage containers, so like IV tubings, like uh, Foley catheter. Remove tubes and catheters, bath soiled areas with plain water, and dry thoroughly. So place a wet protector under the buttocks. Okay, because as I've told you, it will all the secretions will go out. Remove soiled dressings, replace them with clean ones. Put a clean gown on the body, position the body, brush the comb of, and comb the hair if necessary. Then cover the body to the shoulder of the feet if the family will view the body. Okay, if the person is still not seen by the relative, just close the down part and then open the head part. Then gather the person's belongings, put them in a bag labeled with the person's name, remove supplies, equipments, and linen, and straighten the room, provide soft lighting. Then remove and discard the gloves, practice hand hygiene, let the family view the body, provide for privacy, return to the room after they leave. Then practice hand hygiene, put on gloves. And don't forget to put ID tags because in the morgue there are so many patients dying dead patient. So maybe it will be mixed up. So you need to put an ID tags. Tie one to the ankle or to the right big toe. Place the body in a body bag or cover it with a sheet or apply the shroud. Then position the shroud under the body, bring the top down of the head, fold the bottom over, and then fold the sides as you saw before. Then pin the tape or tape the shroud in place. Then attach the second ID tag to the shroud, sheet, or body bag. Leave the denture cap with the body. Pull the privacy curtain around the bed or close the door. Then remove and discard the gloves, practice hand hygiene, and then strip the unit after the body has been removed. Okay, wear gloves for these steps. Remove and discard the gloves, practice hand hygiene, and then report the following. First, the time of the body was taken by the funeral director, what was done with jewelry or other valuables, and what was done with the dentures. So these are the things we need to do during post-mortem care. Thank you.